The Lavender study is a phase 3 trial, placebo-controlled, double-blind, randomized trial that follows on 2 phase 2 trials that previously occurred with trofinetide. So trofinetide was first treated in adults with Rett syndrome, and then a second phase 2 trial was in children with Rett syndrome, and both of those were double-blind and placebo-controlled and showed signals of efficacy, which really gave how it moved forward into this phase 3 trial of an indication trial. And the design of this trial was based on how things were done in the phase 2 for the pediatric trial, with the endpoints being based on what was seen in that trial. So this was a trial that ultimately recruited 187 women and children and girls and women up to age 20, it was 5 to 20 years old. And then there was randomized to either a treatment group with trofinetide or a placebo group. And then they were followed for 12 weeks. And the primary endpoints were 2 measures, which are called the Rett Syndrome Behavior Questionnaire and the Clinical Global Impression of Improvement. So, and this was co-primary, so it was designed so both endpoints had to be met for it to be a successful trial. There was also a key secondary endpoint, which is a communication scale that's been used in other people who have severe communication problems. So the trial met both of the key primary points. It showed statistically significant improvement in the RSBQ and in the CGI, the Clinical Global Impression of Improvement. And in both cases, it had a moderate effect size. It also showed an improvement in the key secondary endpoint, which is also in a similar kind of range of effect size and statistically significant. So for trofinetide, obviously, and I failed to mention, there's a 2 open label extension trials that the people who participated in Lavender were invited to participate in. And there are a number of people who continue to be in those open label trials because they are very long lasting. There's also a new trial that has been started this fall with an open label phase 2 trial for people who are 2 to 5 years old, and that is to make sure it's safe in these younger children. But obviously, one of the next steps for the sponsor is to get together a package to go to the FDA to do a new drug application, an NDA. And I know that they've announced that they're planning on doing a first meeting sometime in the early part of 2022 to prepare, and then they're hoping to submit this NDA sometime this year.